Well, hello everyone. In today's video, we're going to go over the difference between original Medicare and a Medicare Advantage plan. When someone is newly eligible for Medicare, turning 65, or even if they got Medicare due to a disability, this is the question you want to ask. Do I want to stay on original Medicare? Or do I want to get on a Medicare Advantage plan? So let's get right into it. We're going to talk about the difference between original Medicare and a Medicare Advantage plan. Before we could even talk about the difference, I feel like it's very important to understand what is Medicare, how do you qualify for Medicare, and all of that jazz. So let's talk about original Medicare. So original Medicare is standardized by the government. This is health insurance for individuals turning 65, or if you have SSDI, you have a qualifying disability or condition, you can get Medicare after 24 months of being on disability, which is SSDI, right? So if you are turning 65, you earn Medicare, you paid into the Medicare system, you work at least 10 years or 40 quarters. This means that you earn Medicare and you can get on Medicare when you turn 65 or when you retire from work and you had health insurance. So let's talk about what original Medicare and a Medicare Advantage plans both cover, right? What do they have in common? They both cover Medicare Part A, which is your hospital coverage. The easiest way to remember Medicare Part A is remember the letter H because it covers your hospital coverage. So it's going to cover home health care, H, skilled nursing home care, H, and hospice as well, H. So that's how you can remember Medicare Part A. Remember the letter H, like I said, this is your hospital coverage. Now, when it comes to Medicare Part B, which is also covered under a Medicare Advantage plan, this is your medical coverage, okay? So this is things that's done outside of the hospital, such as doctor visits, diagnostic tests, lab, ambulance rides, and such. So you need both. You need Part A for hospital coverage, you need Part B for your medical coverage, and if you're taking medications at your doctor's office, such as the flu shot, chemotherapy, and such, this is also covered under Medicare Part B as well, okay? So that's Medicare Part A and Part B, and we're going to talk about Part C, and Part C is actually a Medicare Advantage plan. And we're going to talk about Part D as well, and Part D is your prescription drug coverage. But first, remember, this video is mostly focused on the difference between original Medicare and a Medicare Advantage plan. So we basically talked about what original Medicare is, which is health insurance. It's regulated by the government for individuals turning 65 or if you have a qualifying disability. So what is a Medicare Advantage plan? So a Medicare Advantage plan is not regulated by the government, okay? These are offered by private health insurance companies, and they actually replace original Medicare. So if you decide to go on a Medicare Advantage plan, you'll have original Medicare, but in the background, okay? You have to have original Medicare to get on a Medicare Advantage plan, but the Medicare Advantage plan actually replaces original Medicare. So how does this work? So basically, Medicare itself will send these insurance companies about $1,000 or so per month per member to take on your medical risk. That is correct. These private insurance companies are actually taking on your medical risk. So you would no longer have original Medicare if you decide to go with a Medicare Advantage plans. We're going to break it down into several categories. Let's start with our first category. And the first category is provider network. Okay, so what is a provider network? A provider network is where you can go to doctors, hospitals, clinics, emergency rooms, urgent care. These are providers, these are doctors, these are nurse practitioners and specialists and such, right? So when it comes to original Medicare, you actually do not have a provider network. Well, let's say you have a nationwide network within the US, meaning that you could go to any doctor that accepts original Medicare. So you have unlimited options when you on a original Medicare, okay? Now, when it comes to a Medicare Advantage plan, you do have provider networks. You must stay within a network or you would pay more for doctors outside of the network. There are two main type of networks when it comes to a Medicare Advantage plan, very similar to employers' health insurance coverage, okay? So you have your HMO plan and you have your PPO. So your HMO, you're going to get more benefits, and we'll talk about benefits later on in this video, and we're talking about dental, vision, and hearing and such. Now with an HMO plan, you have to stay within a network. If you go outside of the network, you would pay more for those providers. So you do have to stay within the network, and you also have to ask for a referral from your primary care doctor to see a specialist, okay? Now with a PPO plan, you can see doctors outside of the network. However, you would pay more for those doctors outside of that network. Now, just because you can see doctors outside of the network does not mean you can see any doctor. The doctors still have to accept that PPO plan as payment, okay? A lot of individuals that come to me and they're like, oh, Patricia, so if I have a PPO plan, I could go to anywhere. No, the doctor do not have to accept your plan just because you have a PPO. A PPO just means that you can see doctors outside of network as long as those doctors accept your PPO plan for payment, okay? So the PPO has in-network providers and outside of network providers. With a PPO, you do not need a referral to see a specialist. However, with a PPO, you will get less benefits most of the time. So you get less dental, vision, and hearing and such. And with a PPO, most likely you will pay more for doctors outside of that network, and you don't need a referral to see a specialist. So a PPO can be really nice, okay? Now let's talk about our next category. Our next category is services covered, okay? So we talked about that, Medicare Part A is your hospital coverage, Medicare Part B is your medical coverage. Original Medicare is limited when it comes to certain services. So original Medicare only covers Part A and Part B. It does not cover certain things such as dental, vision, hearing, or prescription drug coverage, okay? Now, when it comes to a Medicare Advantage plan, you can get these extra perks. A lot of these Medicare Advantage plans make their plans very attractive so that way you enroll in their plans. So they will give you extra perks such as dental, vision, hearing benefits, prescription drug coverage, and such. And sometimes they would add a little extra as well. For low-income seniors, you may be able to get a healthy food card. If you are a senior with a chronic condition, you may also be able to get a healthy food card as well. They offer additional things such as gym membership and such, okay? So like I said, this is to make the plans more attractive so that way you enroll in their plan. Okay, now let's talk about the next category. The next category is going to be your out-of-pocket costs. Now this is very important, and this is why a lot of individuals will choose a Medicare Advantage plan, okay? With original Medicare only covers 80%, leaving you behind 20%. Now, this 20% is something you do not want to play with, okay? So how can you get this 20% covered under original Medicare? Well, you have two options actually, right? So you can actually get on a Medicare supplement plan, not to confuse this with a Medicare Advantage because it's not the same. So a Medicare supplement plan will follow original Medicare. So like I said, original Medicare covers 80%, leave you behind 20%. You could get on a Medicare supplement plan and stay on original Medicare, and the supplement will pay that 20% that Medicare leaves behind. I highly recommend that you either get on a supplement plan or a Medicare Advantage plan, because 20% of $1 million bill is a lot of coins, okay? So you definitely want to stay on original Medicare and get on a Medicare supplement plan, or we're going to talk about our second option, which is a Medicare Advantage plan. Now, one thing I love about Medicare Advantage plans is because the max out of pocket, there is some protection versus original Medicare alone. There's no protection, there's no cap, there's no ceiling. At least with a Medicare Advantage plan, you know your max, okay? So your max out of pocket is the max amount that the insurance company is allowed to charge you in a given year. So depending on that Medicare Advantage plan, whether it's a HMO plan or a PPO plan, now the PPO max out of pocket is usually a lot higher than an HMO. So it can look like this, especially here in Florida. Our max out of pockets are very reasonable. It could be about $3,000 in Florida. I have seen max out of pocket that is $500, believe it or not. So yeah, like I said, your max out of pocket can be $3,000, $5,000, $9,000, $10,000. It just depends on your area, your zip code, and where you live in the USA, right? So it depends on the state as well, what your max out of pocket can be. And of course, it depends on that particular plan. So it's very important when you pick a Medicare Advantage plan, you know your max out of pocket. You will know exactly if something happened, God forbid, worst case scenario in a given year, what is my max? It's very important to know your max out of pocket. So yeah, at least a Medicare Advantage plan does have a max. Now, if you decide to stay on original Medicare and you get on a Medicare supplement plan, then all you have to really worry about is your annual deductible, which is really nice. In 2025, it's $257. Now, that Medicare supplement plan is also going to have its own monthly premium, so keep that in mind as well. So if you could afford a Medicare supplement plan, it can be a great option because, like I said, it covers that 20% that Medicare leaves behind. Now, when it comes to a Medicare Advantage plan, most likely the monthly premium is zero, but you have co-pays, okay? So you're going to pay as you go. You're going to pay as you are using that plan. And remember, there is a max out of pocket, which is really nice as well. So let's talk about the cost for a little bit. Okay, we talked about the max out of pocket. We got that covered. Let's talk about the actual premiums. So original Medicare, Medicare Part A, the monthly premium is zero for most individuals. If you worked and paid your Medicare taxes, you worked for 10 years, you're 40 quarters. Medicare Part B in 2025 is $185 a month. And this is the standard Part B premium. There's something called the IRMAA Chart. Depending on your income, you can pay more than the standard Part B premium. We're going to leave the IRMAA Chart here. You can pause it and you can look how much would you pay depending on your income. Like I said, the standard monthly premium is $185. If your income is over a certain amount, you can see here on the chart, you're going to pay a lot more than your standard $185 per month. And you will also pay a Part D premium as well. So like I said, pause the video, study the charts, and determine if you have to pay more than the standard $185 a month for Medicare Part B. Also, if you decide to go with original Medicare, Then you also have a Part B deductible as well. In 2025 is $257 for that year. After you pay your Part B deductible, then the Medicare supplement plan will kick in and pay that 20% that Medicare leaves behind, which is really nice. So yeah, so that is pretty much the cost when it comes to original Medicare with a Medicare Advantage plan. Like I said, in most areas, a Medicare Advantage plan monthly premium is zero with copays, okay? And here are some examples of some copays. Usually a primary care doctor visit would be zero. Specialist may be $15, $20. X-rays may be $100, $15, $30. It really just depends. Urgent care may be $50. Diagnostic tests may be $100. Days in the hospital could be $250 per day. And remember, you also get some extra benefits. Maybe you get like $1,500 to $2,000 towards dental, $300 towards vision, $1,000 towards hearing. So yeah, it really depends on the zip code you live in, the state you live in, and the Medicare Advantage plan that you actually choose, what your copays will actually be. So yeah. Now the last category we're going to talk about today is prescription drug coverage, okay? So original Medicare does not cover prescription drug coverage, and this would be, of course, prescribed by your doctor, medications that is taken at home. This is not covered under original Medicare. So that means you would have to purchase a standalone drug plan. And this is also known as Medicare Part D, okay? So if you're on original Medicare, hopefully with a Medicare supplement plan, you also need a standalone drug plan as well. Now, if you decide to go with a Medicare Advantage plan, most likely the Medicare Advantage plan will include prescription drug coverage. So how do you choose a drug plan? Of course, it's going to be based on the medications that you are currently taking. That's how you're going to choose the drug plan that best fits your particular needs. These drug plans are going to break down the cost of your medications by the tier of the medication that you take. So tier 1, 2, 3, it could go all the way to tier 6. And of course, the first tier is going to be your preferred generic medications. A lot of times these medications would be a $0 copay or maybe a low cost $5 copay, depending on that particular drug plan that you choose. You're going to look at the medications that you take, and that's how you determine the drug plan that best fits your particular needs. Our office will handle all of that. So we will gather the doctors that you see, the medications that you take, and we will help you determine what Medicare supplement company that you should go with and a drug plan, or if you want to go with a Medicare Advantage plan, we will help you narrow down the best Medicare Advantage plan for your particular situation, your particular needs. There's no such thing as the best Medicare Advantage plan. It's really what's best for your particular situation. Do you have a chronic condition? Do you have anything special going on? Are you on oxygen? Do you have to see a nurse that comes to your home? Do you have to go to dialysis? There's so many variables. There's so many different situations that individuals have going on. So you never want to pick a plan based on what your neighbor has or your best friend. Your particular needs are your particular needs, okay? So yeah, in today's video, we talked about the difference between original Medicare and a Medicare Advantage plan. I hope we made it super clear for you to understand. Thank you so much for watching this video. If you know anyone that needs this information, share this video with a friend. If you have any questions, comments, let me know in the comment section below, and I'll be more than happy to answer your question. If you need any assistance with any of this information, give our office a call. We charge nothing for our services. We'll be more than happy to help. Thank you so much for watching. If you're not subscribed to the channel, definitely subscribe, and I'll see you on the next one. Bye.